Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com, the weekly roundup for September 26, 2025. Recent publications in women's mental health. Break. Here is the CWMH Weekly Roundup draft, organized per your instructions with each article placed under the most relevant section. PMS and PMDD break. No articles this week. Infertility and mental health break. No articles this week. Psychiatric illness during pregnancy break. Maternal vulnerability to insomnia, relationship with poor newborn sleep and peripartum psychopathology. Pejcic L, Bruni O, Colizzi M, Comacchio C, Gemignani A, Nobili L, Balestrieri M, Drake CL, Insomnia in Pregnancy Research Group, IPRG. Sleep Med. 2025 August 6 134 to 106.732. Prenatal elevated sleep reactivity predicted postpartum insomnia, or 4.50, anxiety, or 3.44, depressive symptoms, or 4.45, and poor newborn sleep, or 3.43. Break. Neurophysiological features in women with antenatal depressive symptoms, arresting state quantitative electroencephalography study. Kim H. J., Lee D., Kim J., Kim N. Y., Hong S., Myung W., Lee H., Park J. Year Psychiatry Clin Neurosci. 2025 August 11. Distinct Keeg patterns in pregnant women with EPDS. 10 suggest potential for Keeg as an objective biomarker of antenatal depression. Break. Psychological distress and maternal outcomes in women with pre-eclampsia, a retrospective case control study. Ganji Faye, Faramarzi M, Bouzari Z, Khafri S, Bazgir MR, Netadj M Health Sci Rep. 2025 August 88, E71133. Women with pre-eclampsia had increased prevalence of anxiety and depression, associated with adverse maternal and neonatal outcomes. Break. Restless legs syndrome during pregnancy and puerperium. Hakatal S, Esteves AM, Riccardi S, Garbazza C, Manconi M. Sleep. 2025 July 25. Around 20% of women experienced severe to very severe ILS symptoms, persisting across all trimesters. Medications and pregnancy break. Association between the effectiveness of labor epidural analgesia and postpartum depression, a prospective cohort study. Curkovic SB, Milic JZ, Sharpe EE, Pejcic NZ, Pujic BP, Stojanovic-Tasic MP, Djakovic ED, Curkovic AI, Perovic MD, Pikula AA, Rancic NK, Djakovic MM, Bobic GM. Janusz. 2025 August 9. While epidural analgesia provided effective pain relief, it did not affect the risk of postpartum depression. Maternal perception of pain relief may be more impactful. Postpartum psychiatric illness break. Positive psychology-based intervention program for postpartum depression among pregnant women within the primary healthcare system, protocol for UACT Fan Z, Wang M, Su J, UR, Wang J, Yanex, Xia W, Gong YBMJ Open. 2025 August 15-8, E101115. This RCT protocol evaluates whether a positive psychology intervention in primary care can reduce postpartum depression risk. Break. Treatment of traumatic birth experience with postpartum early eye movement desensitization and reprocessing therapy, a randomized clinical trial. Hendricks Y. Emger, Van Pampus MG, Hoffman A, Henriks J, Van der Horst He, De Jong A. MJ Obstet Gynacal. 2025 August 4. EMDR therapy was effective and safe for reducing PTSD symptoms and distress following traumatic birth. Break. Postpartum distress among women with and without ADHD. Babinski D, Rigel K, Tuan W. J. Clin Psychiatry. 2025 May, 86-3, 24 M15724. Women with ADHD reported higher rates of depression, OCD, and stress-related disorders postpartum compared to those without ADHD. Break. Mom supporting mom, Effective peer support intervention for women with postpartum psychological distress. Cibelu A, Horokova A, Nemkova H, Kuklova M, Noskova E, Svansa P, Bayat N, Janovska A, Glikovic A. Psychosakintov. 2025 September, 34-3, 151-160. This peer support intervention reduced depressive and anxiety symptoms and improved quality of life, highlighting its utility as a scalable, low-intensity intervention. Break effects of maternal depression and self-efficacy during pregnancy on postpartum bonding. Bergman R, Msheimer S, Hogenbeck C, Balan P, Feem T, Charles NK. J. Reprod Infant Psychol. 2025 August 3. Higher depression and lower maternal self-efficacy during pregnancy predicted impaired mother-infant bonding at 6 months postpartum. Break causal relationship between migraine and postpartum depression, a Mendelian randomization study. Joxj, Shen R, Nui M. J. Payne Rees. 2025 July 22 18 to 3675 to 3687. This MR study found no significant causal relationship between migraine and postpartum depression. Break associations of NICU-specific stressors with postpartum depression. Mari K, Hokem K, Dardan N, Burris H. Am J. Perinitol. 2025 July 24. 41% of NICU mothers screened positive for PPD, strongly associated with stressors related to parental role loss. Break the impact of online mindfulness interventions on postpartum depression, a systematic review and meta-analysis. Lu Q, Yuan J, Shi S, Du M, Jiang E and J. Mental Health Nurse. 2025 August, 34-4, E70085. This meta-analysis of 23 RCTs, 2,725 participants, showed online mindfulness interventions significantly reduced PPD symptoms. Break breastfeeding interventions for preventing postpartum depression. Linnells M, Uphorfy, Marshall D, Wilson E, Gustafson A, Wells M B, Anderson E, Dennis C. L. Cochrane Database Syst Rev. 2025 February 18 2, CD014833. Psychosocial breastfeeding interventions may modestly reduce short-term risk of PPD and increase breastfeeding duration. Medications and breastfeeding. Break no articles this week. Perinatal substance use. Break no articles this week. Maternal mental health and child outcomes. Break perinatal maternal depressive symptoms and brain connectivity among 9 to 15-year-old offspring. Korch D, Hermans APC, Su B, Mutzel RL, El Maroon H, Timoyer H. Jamanet Wopen. 2025 July, 8-7, E2523978. Prenatal maternal depression was associated with altered trajectories of functional brain connectivity in children ages 915 years. Menopause and mental health. Break no articles this week. Other topics in women's mental health. Break suicidal ideation in the postpartum period, a population-based study of prevalence and risk factors. Despotis A, Harrison S, Quigley M A, Alderdice F, Felmuth G. J. Affect Disorder. 2025 November, 389 to 119707. In this population survey, 11.4% of women reporting suicidal ideation postpartum did not meet criteria for probable depression, underscoring the importance of screening beyond depression scales. Break self-injurious thoughts and behaviors from pregnancy to postpartum, risk factors and clinical implications. Molina, North Carolina, Kalush PR, Mendez S, Popple A, Wright KR, Joe A M, King KM, Conrad T, Crowell SE. Suicide life threat behave. 2025 June, 55-3, E70030. Women were more than 3 times as likely to engage in self-injurious behaviors during postpartum compared to pregnancy. Break behavioral activation for perinatal suicide ideation, secondary analysis of RCT. Kalush PR, Molina, North Carolina, Barenbaum T.S., Dennis C.L., Gainsby N, Meltzer Brody S, Reyes Rodriguez ML, Silver RK, Stubay M, Vigard SN, Schiller CE, Singler DR. JAMA Psychiatry. 2025 August 20. Behavioral activation psychotherapy significantly reduced perinatal suicidal ideation, with risk decreasing most at 3 months post-randomization. Break incidence and risk factors for suicide attempt during pregnancy and the postpartum period. Goldman Meller S, Olfson M, Gemel A, Majerison C. Jacqueline Psychiatry. 2025 March 5 86 2. 24 M15633. Several clinical factors including prenatal suicide attempt visits, assault, psychiatric visits, and major psychiatric diagnosis were associated with a 430-fold increased risk of suicide attempt postpartum. Break. Would you like me to write the short introductory summary paragraph, like in past roundups, highlighting the week's big themes such as peripartum sleep, new PPD interventions, and maternal mental health outcomes? rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.